Let's talk about partner communication. And this is really important. I think a lot of the questions we got really asked about, many asked about how do we engage in this subject, and what do we do if our partner is, has apprehension about this? And that's a great question. First things first, when we don't talk openly with our partners, we can develop feelings of helplessness, frustration, guilt, and even selfishness. Now, I'm going to break that down. Why this is not just for we as the ostomy, but also our partners. Okay, our partners may feel guilty to ask, and you may feel guilty to withhold. Right? There may be frustration on each partner's part, but the most important thing is if you communicate and have an open relationship, if you really try to make time and preface these conversations, and I'll give you some patter to go along with this, it goes a long way to building trust. Because oftentimes my patients tell me that their partner didn't want to bring it up and make them feel bad, and vice versa, right? But then when they started talking and really sitting down and making time to talk about it, they started to actually build trust. That wall was starting to come down. So it's really important to break the ice and make time to have these conversations. If you delay the conversations, it delays that building of trust. And trust is really important, of course, when engaging in intimacy, let alone sexual activity. This is really important if you're engaging in a new relationship. Disclosing it is extremely important and it's completely different when it's a new relationship. If you're just dating, right, as opposed to a monogamous long-term relationship where the partner knows. So, does that mean you have to tell them on the first date? No, there's no right or wrong time. But disclosing earlier is probably better than later. But obviously, every relationship is different. The comfort level is different. The main thing is, remember, work towards good communication skills from the get-go, and then you may find a better time to open and disclose having an ostomy. I do have patients who have dated, have an ostomy, and have found partners who are loving, willing, accepting, and they have beautiful relationships. But it takes time, and it takes time of disclosure and communication. A common question that I get, before I move on, is about having perianal skin tags even after surgery. If you don't have the proverbial Barbie butt and you still have skin tags, many patients find that to be cosmetically embarrassing. But I'll tell you what, I'm a gastroenterologist. I shine the light where the sun don't shine, if you will. And so many people have perianal skin tags, hemorrhoids. There's so many different types of appearances to the anus. There's no, normal way. Everyone's different, and it's very, very common. And in fact, if you're embarrassed to show it to your partner, I guarantee their anus is going to look different too. So there's no such thing. There's no ideal beauty, if you will, of the anus. Everyone's different. I often get asked, can we have the skin tags removed? The answer is, I don't recommend doing so, because it's unnecessary surgery. I'm happy to answer more questions about that a little later. So how do we get comfortable? Well, I talked about communication and disclosure, right? Relieves anxiety, builds trust. Another way is to explore the ostomy together. And I know that sounds scary, right? We're worried about having stool spill out, or having them look at it or examine it. One of the places that many of my couples have explored this is actually the shower, right? It's been cleaned, you've emptied it, but being in the shower can wash away quickly. I was first surprised when I heard about this, but now that I've shared it with people, they've done this with their partners, and for them, it can work. But again, it takes time to build up that trust. Joking, laughter saying is the best humor, right? That was like, I remember Reader's Digest. It was a thing when I was growing up. I used to read that all the time. And there was always laughter as the best humor section. But I find that, tasteful humor, laughter really can go a long way towards breaking the ice, right? When we, sometimes, patients like name their ostomy, right? Or they make jokes about it in good taste, of course, right? But that can actually break the ice. So sometimes using humor can go a long way. How do we set the mood, right? Setting the mood is really important, right? Again, it's about creating that intimate environment. And you can be intimate without intercourse, right? Intimacy can take so many different shapes. And I say just holding hands, sitting next to each other close on the couch, watching Netflix shoulder to shoulder, or leaning this is called intimacy. And that's so critical, important. That's the first step before, in my opinion, before you can actually engage in more sexual activity. You can even start to talk about your feelings, right? Your fantasies. What would you like? What would you want to have done? You can ask, what would you like done, right? And then, of course, indulging in the good old fashioned, senses, the music, the candles, right? Lingerie, a romantic, rom-com or movie, those things count, right? And there's different ways to set the mood. Everyone's different. But when you talk to your partner, you can find out what gets them going. Now, we're often talking about discussing clothing. So for men, this is actually an example of swimwear, but there's also other high-waisted pants for men and women that can be cover-ups for the stoma to keep it intact. But that's one way to actually disclose for women when going to the pool. There's also high-waisted bikini tops or one pieces that have really come back into fashion quite well. There's many different online retailers that produce these type of swimwear. So if you're going out to the beach or the swimming pool, then you have many, many different options. When it comes to cover-ups, actually, there's many different types of cover-ups for the ostomy bag itself that slip on over the ostomy bag. There's also ostomy deodorizer pills that are often bismuth-based that can be either droplets, or tablets that you can take by mouth, or you can put directly into the ostomy bag to deodorize the bag. There's all sorts of different types of sexy lingerie and nighties or slips that may or may not suit your taste. But the point is, there's many options that can help you feel sexy, that can help you feel confident and feel better about your body image. This is a jest. My other bag is a Gucci, just to emphasize there's different options for clothing. And again, there's different types of cover-ups for the stoma that can mask sound and also mask smell. I want to talk a little bit about lubricants. There's different types of lubricants, and you have to be careful. You can't use all of them, okay? Water-based, when in doubt, use a water-based one. That's not going to cause infections. It's not going to cause any issues or problems. You're never going to go wrong with a water-based lubricant. You have to be careful about some of the other ones, particularly oil and petroleum. These can actually leave thick coatings in the vagina or the rectum or anywhere else that slip and slides to, that can actually breed infection. They don't come out. They trap bacteria and cause problems, okay? Silicone can be used with condoms, but not with toys. Again, you don't want to insert that. They're sometimes too slippery. So if you wanted to err on the side of caution, use a water-based lubricant. That's always the best thing to do. If you want to learn about other people's exploits, there's a couple of good books that I can recommend that you can obtain. And then, of course, we're going to list some online resources that the ostomy.org Foundation has on their website.